Welcome to the Supported Living Property Podcast with your host, me, Lisa Brown, the place to learn about supported living property investing. Hi, Suzannah. It's great to have you here today. For people who don't know you, would you like to introduce yourself, please?
Yes, hi Lisa. Thanks for inviting me to be on your podcast. So my name is Suzannah Young and I work for the National Housing Federation in the policy team. The NHF is the trade body for housing associations in England. We're a membership body and our members are all housing associations. They are not-for-profit social landlords and around about 75% of supported housing is delivered by housing associations, which is why it's relevant to talk about them on this podcast. What we do is, so we represent our members. We kind of ask them for views and what their kind of main challenges and concerns are, and also, what good practice there is. And the role of the policy team that I'm in is to try and represent our members to government, so speaking to officials and ministers, and trying to kind of give examples of things that our members will need, or feedback on consultations or inquiries the government's doing. Really, excuse me, just kind of feed in our members' needs to government and hope to change policy where it's necessary to make sure that more social and, of course, supported housing can be developed ultimately.
And that's where it's really useful, isn't it? Because you're kind of a spokesperson for, as the body for a lot of different organisations, aren't you? Bringing that voice together collectively to campaign, which is really important, isn't it, at the moment, especially?
Yes, and it's a real privilege to be able to talk to the experts on the ground, really. We would be nowhere without our members and the insights that they can bring. So it's really important that we can be that kind of collective voice for what is affecting our members and what they're saying. So it is a kind of important role.
Yeah, absolutely.
To get that across.
We've obviously just recently had the budget as we're recording this at the end of middle to end of November in 24, so it's given you a bit of time to kind of reflect on the budget and the impact of that. What is the main feedback from your members around the budget?
Yeah, well, so as you probably know, supported housing is unfortunately in quite a challenging financial situation at the minute. We have experienced a number of years of cuts to support budgets. Revenue funding is kind of going down, really. And there are also challenges with capital funding that doesn't necessarily cover the full cost of building supported housing. There are also some challenges around housing benefit. So it's a really challenging financial environment, and we were hoping for some specific funding for supported housing. So we've asked for ring-fenced funding for support that would be a kind of long-term settlement and enough to be able to so that local authorities are able to commission supported housing. We also asked for kind of emergency rollover funding for commissioning, because we've seen some local authorities feeling like they have to decommission supported housing because of the financial pressures on them. So we were asking for a kind of emergency fund to stop that from happening. The government did announce funding for homelessness and rough sleeping. It was 233 million, and also 600 million for social care, which is important and hopefully positive. We still need to work with officials, with the government to know how much of that, if any, is specifically for supported housing. It's not clear yet. And we were disappointed that there wasn't a kind of specific ring-fenced fund for supported housing, something that we've been campaigning for a long time. We'll be kind of making that case in the lead up to the spring spending review. So we're hoping that we'll see something there. The other thing that has kind of caused some consternation among our members, or alarm among our members, is that the government has announced that national insurance contributions, employers' national insurance contributions will increase. And because our member services are very staff intensive, kind of given the needs of residents, it's likely to increase their staff costs quite a lot at a time when those costs aren't necessarily being met fully through contracts. So kind of the support funding to commission supported housing pays for staff to deliver the support. So if those costs are going up, but contracts aren't increasing, then there's going to be a real squeeze on the rest of the supported housing budget. So we are engaging with the government on that. We're hoping that our members will be able to kind of bring that to life with their kind of local representatives as well. So we're hoping that there will be potentially some attention to that from government, the kind of specific impact on supported housing.
They're very staff intensive organisations often, aren't they? Particularly the ones that support people with support needs. Yeah, it does have a huge impact on them, doesn't it?
Yes, and I mean, it's really important that there be that level of staffing so that residents have the support that they need. So to kind of get support with the things that they need help with, but also so the service can be safe. So it's important that staff staff wages are paid, and that they also have a kind of decent wage for the kind of to recognise the difficulty and the importance of the job that they do. So of course we'd be in favour of them being paid a wage that is commensurate with the responsibilities they have. At the same time, that does need to be fully funded so that kind of at the end of the day, supported housing can carry on providing the services that it does and that are really, really necessary for tenants.
Yeah, absolutely. There's a question I'm asked all the time when I'm talking about supported housing is how many properties are there how many supported housing properties are there across the country, and what is the demand going forward? And it's historically been quite hard to get hold of that information, hasn't it?
Yes, we actually did some research on this earlier this year. We commissioned Altair Limited to do research on the need for supported housing, and they demonstrated through their research that there are quite a lot of kind of different data sources that they had to look through to kind of find the answer, and there isn't one single data source that collects kind of how many people are in supported housing and how much need there is. So they did have to look at quite a few different things. They concluded that at the moment, supported housing helps around 500,000 people in the community. And although what it does is really important for those people living there, unfortunately, kind of the supply of supported housing isn't keeping up with demand. It's actually gone down in recent years, the kind of number of units.
So it's actually decreased the number of units.
Yeah.
Right.
Yes, and that research concluded that to be able to kind of keep up with population change and to kind of deliver enough supported housing to meet need by 2040, we would need another 167,000 units at least.
Wow.
But that is also likely to be an underestimate because there's a lot of unmet need at the moment, and kind of people who are living in other circumstances who might benefit from supported housing. So kind of people who are waiting to be discharged from hospital or waiting for a Care Act assessment, people living with their family who actually might be better in a kind of served in a supported housing service. And actually there is now some more research that's been published by the government just recently, it's the supported housing review that was kind of redoing, or not redoing, but updating some research that was done back in 2016. So it was really important that that research be done. And kind of that research has found that there is a lot of unmet needs. What they did was they surveyed commissioners, so people who commission supported housing in local authority areas, and kind of large numbers of those commissioners felt that there was either some or a lot of unmet needs in their area. Around over 50% of commissioners said there was a lot of unmet need.
Wow.
Yeah, and I think it was around 80% that said that there was unmet need, some or a lot. And what that research concluded was, so the supported housing sector would have to increase from its current size. So the government's research says there are 634,000 units of supported housing now. It would have to increase to between 995,000 and 1.2 million units by 2040 to meet current demand. So that's, a kind of huge increase, really.
Massive,
at
yeah.
least 300,000 more. And the research also talked about the kind of really, challenging situation that supported housing is in, that I've already mentioned, and that so to be able to deliver the supported housing that's needed, there needs to be kind of a real investment in supported housing, kind of with the understanding that investing in supported housing will also bring benefits to obviously the people who need it, and the kind of society as a whole, and kind of public funds, because we know that supported housing also takes pressure off statutory services, so residential care or temporary accommodation or hospitals. When people can live independently with support, it's better for them, and it's better for kind of local authorities that are footing the bill, if you like, for them to be in supported housing rather than in the kind of more costly statutory services that won't be beneficial for people if it's not actually what they need. I was reading a blog post on hospital discharge a little while ago, and it said kind of when people are discharged from hospital into residential care, when they don't actually need residential care, but that's the only thing that's available, their kind of level of need actually increases rather than decreases, because they are kind of having everything done for them and they're not independent anymore. And so they have kind of early onset of frailty, because they're no longer kind of providing for themselves. And so if they were in supported housing where they get support to do things, but it's not done for them, they kind of, their needs can be better served. So it is, really important that we invest in supported housing to kind of better serve people, and to, well, better serve local communities, if you like, so that there's funding for residential care for the people who do need residential care.
There's significant cost savings, aren't there, as well as quality of life savings, with people being in the right settings and the right homes. But the numbers are staggering, aren't they? They're really big increases in the next 15 years if we're to meet that need. Does it talk about what kind of properties are needed broken down within it, or is it just, do they just talk about units when they're sort of talking about it? Is this vague, we need this number of units sort of thing that they're talking about?
So the research does talk about kind of the different types of needs, if you like. So broadly, it separates it into older people and working age people. So it says that by 2040, we'll need between about 560,000 to 800,000 units for older people, and 275,000 for working age people. But there are kind of figures on the different types of working age supported housing as well. So it's kind of divided into people with mental health needs, people experiencing homelessness, people with a learning disability and autistic people, young people, care experienced young people. So it says kind of to maintain current levels, we'd need 24% more supported housing units for working age people, 2,000 for single homeless people, 1,000 for homeless families, 2,500 for people with a learning disability and autistic people, 500 for people with mental health needs, and then 1,400 for other groups. But that's just maintaining the current levels of provision. So obviously need is likely to go up. So we'll need more than that to meet the increasing levels of need.
I'd say some of those numbers, particularly around the mental health ones, seem quite low, don't they?
Yeah,
You know?
yeah.
And I think that's probably because it's currently underserved. So if they're talking about the current provision, you know, it's probably.
Yeah. I mean, and that's the thing that we found with our the previous research. What we were able to find out or kind of predict was based on current occupancy rather than current need, because there isn't really anything that says need. No. So if we're kind of basing projections on current occupancy levels, that's assuming that need is being met, but we already know that it isn't. So definitely there'll be kind of needs for more supply. And the other thing is we have an aging population and kind of greater numbers of people living with age-related disabilities and more complex levels of need. So kind of those people's needs will need to be taken into account as well. So it could be that kind of even more than just simple kind of population increase, the need for supported housing will be going up because of the increased level of need among people as well. So it's quite kind of a big ask, really, but really important to make sure people's needs are met.
So I think the summary is there's massive need still, isn't there? We're nowhere near even meeting current need, I think, probably in a lot of different, types of support, and the future need is high. So I think when people are thinking, is this a growth sector? It definitely is, isn't it? From a developing or from a service provision point of view, there's very much a lot more need there, isn't there?
Yes, that's true. And then kind of one good thing is that you probably know about the Supported Housing Act that has it is law, but at the moment there hasn't been a consultation on the regulations, and so it's not come into force yet. And we have actually heard there will be a consultation from in the spring. But one of the provisions in that act is that local areas will have to have a supported housing strategy. And those strategies will hopefully assess what the need is for supported housing locally, and also allow local areas to come up with a plan for how they're going to meet that need, for kind of how many new units will need to be developed. And kind of we're hoping that there will be a requirement that kind of all needs should be taken into account, and it will not be possible to kind of not develop supported housing for certain groups. It should be kind of local areas should have to kind of work with families, people in need of support, supported housing providers, maybe hospitals, maybe kind of social care, to really get at what the need is, and how those needs will be best served. So there is a potential that there will be more data on what is needed. in the future when those strategies start being drawn up.
I think so, because I think people are quite surprised sometimes when when you're talking to local commissioners and they don't necessarily know exactly what's happening in the areas, because it's not all commission services, or it's there's stuff's been developed in different ways, hasn't it? So I think having that overall picture from each local authority is going to be very helpful, isn't it?
Yes, I mean, it can potentially also show that what is there at the moment isn't what is needed, and so there needs to be a kind of reconfiguration
Yeah.
of the services provided. Kind of we're hoping that the kind of strategies will also demonstrate, kind of be another, if you like, another way of showing how much funding is needed to develop supported housing, kind of how much investment will be needed to meet the needs that are being assessed. So it should be a kind of a useful exercise to really paint a picture of what we need, much more than we have now.
Mm. Mm. Yeah, absolutely. You were also talking beforehand about decommissioning and about what's happening with that at the moment. For people who aren't familiar with decommissioning, what do you mean by decommissioning?
Yeah, so as I was saying earlier on, so local authorities commission supported housing. I mean, that can mean that they kind of state a need for supported housing and they want somebody to fulfill it, but it's also that they are paying for a supported housing service, and that commissioning in the funding sense is paying for support, so paying for the staff who will deliver the support. So it will be a contract of for maybe 1 or 3 years, kind of hopefully longer, but to say we need this service and we need you to provide it, and so kind of these are the things that we would like the service to do, and so a supported housing provider will kind of make a bid to be able or to apply for the contract. So yeah, commissioning is kind of setting out what is needed, but also kind of paying for provision of the service. And kind of what we've been hearing from our members is that unfortunately, kind of given that there has been kind of less and less central government funding to commission supported housing. So local authorities over the past decade or so have been receiving less funding to be able to allocate to supported housing. They're now facing quite or very kind of tight financial situations as well, not just because of this, but kind of in the round, we know that local authorities are struggling, and they're having to make cuts where they can. And kind of given that supported housing is not a statutory service, some local authorities have kind of been feeling that they have to cut these services, they have to stop commissioning them, or even so decommission, so just to kind of end a contract, or not recommissioning, so when a contract comes to an end, not kind of extending it or kind of retendering. So it is, it's a saving in the short term, really, for the local authority, but unfortunately, it's likely that it will cost kind of more in the long run, because people who live in supported housing, they need to live somewhere, and so it might be, as we were talking about earlier, that they live in residential care, or even temporary accommodation if they are homeless, and the costs of those types of accommodation are higher than supported housing, and not kind of necessarily meeting people's needs. And we know about kind of temporary accommodation is causing kind of huge cost burdens for local authorities, up to kind of 50% of their budget sometimes, and it can be kind of what pushes local authorities over the edge. And we're hearing about kind of councils that are at risk of bankruptcy, a number of them are pointing to kind of the cost of temporary accommodation as what has brought them to that point. So it's a real shame, I think, that we're kind of in this situation where local authorities are finding that they have to make savings, if you like, but that aren't going to be a long-term saving, and they're not going to have kind of the best outcomes for people locally. So yeah, it's
So is this something we're seeing all across the country, is it, or is it just certain areas that are reporting it, or?
We've been kind of asking our members to report where they are hearing about these kinds of proposals, and sometimes where it has already happened. And yes, I'd have to say it is kind of all over. It's not a kind of specifically southern or northern or kind of any specific area. We have heard of it all over. So it is a kind of widespread problem that we are kind of hoping there will be a solution to with kind of greater levels of kind of specific funding for supported housing, because at the moment supported housing is kind of coming out of other budgets, social care budgets maybe. There isn't any longer a ring-fenced fund for supported housing. There did used to be. It was the Supporting People programme, people listening who remember that, and that was kind of specific central government funding to local authorities to commission supported housing. But the ring fence was taken off that fund in, I think, 2009, and at the same time as the ring fence being taken off, the kind of levels of funding that were available to local authorities gradually kind of went down and down.
Right.
I think there is a figure the National Audit Office did. They published a report. This is in 2017 now, so quite a while ago. But between 2010 and 2017, funding for support was decreased by 69%, which is a huge number really. And
that's the support rather than the housing element. That's
yes,
the support side of it.
Yeah, but it's really needed for supported housing to stay afloat. There are kind of three elements really. There's the capital funding, of course, to develop the buildings, and often it's kind of more expensive than a general needs building because they might need to be specialist, kind of meeting people's needs for accessibility, but other things like, I don't know, a sensory room, for example, or specialist features. And then you have kind of rent and service charges that will need to obviously cover the cost of kind of delivering the building and the kind of repairs and things, and the kind of accommodation related services. And then you have support, so the revenue funding, which is, as I said before, kind of the staff delivering the support. So those three things really need to be in harmony.
Yeah, absolutely. Just for people listening, this is the support from the housing associations, and it's not this, maybe the care provider might come in separate to deliver the personal care and stuff, but this is the sort of intensive housing management support, isn't it? And helping.
Yeah, rather than care. Yeah, absolutely. Yeah, things like I don't know, helping people access services locally, kind of linking them in with a GP or kind of a job club, or helping them kind of reconnect with their family or friends, kind of get involved in the community, helping them with like in claiming all the benefits they're entitled to, kind of employment and training. There's sometimes kind of reminding people about kind of shopping or medication or things like that, but it's not administering it. So it is a kind of support service rather than delivering kind of personal care, which is more to do with kind of washing or kind of dressing or feeding people. So it's not as I don't want to say it's not as intensive as that, but it's
a different category.
Yeah, exactly.
Yeah, absolutely. Yeah. So that's a huge reduction, isn't it? And that's obviously going to have massive impacts on the quality of support and staffing that can be delivered if it's being cut so highly, isn't it? It's really significant.
Yeah, keeping people safe as well, kind of.
Yeah, it's huge, isn't it? There's so much we could talk about, Suzannah. We could carry on forever, but I think we probably should stop. But we'll put the links to some of the documents and the reports and stuff that you discussed. We'll put those into the show notes, and we'll put the website address if people want to find out more about the work that you guys do. We'll put all of that in there, and we'll watch this space. I think it's going to be interesting, isn't it, to see what happens with the consultations that are happening in the spring, and like you say, with the spring budget, whether we manage to get some funds ring fenced for supported housing. That would be really, really needed, as we've highlighted here today. But thank you for coming on today, Suzannah. I really appreciate you taking the time.
Oh, well, thank you. Yeah, it's been great to talk this through, and yeah, thanks for inviting me.
Thank you.
Take care.
Bye.